Hello, I'm glad to see you again in the third episode of Pro-gnosis, or Professional Knowledge. For those who have just joined us, this is the series of lectures designed for medical students, postgraduates, and junior doctors to help them pursue the course of infectious diseases easily and to comprehend and learn with joy and interest. The idea behind the course is not just to revise the university material, but to get practical knowledge on how to approach and manage patients with infectious diseases, how to recognize the possible cause, and what would be the most suitable method of diagnosis. My name is Dr. Stepan Karabinish, and I am a physician specializing in infectious diseases and pediatrics. This time, we'll open a chapter of infectious diseases of digestive system. Let's remind ourselves all the parts of digestive tract. It starts with the oral cavity and throat, or pharynx, esophagus, stomach, small and large intestine. All parts of digestive system are separated by anatomical structures, or sphincters, such as upper esophageal sphincter, lower esophageal sphincter or cardiac sphincter, pyloric sphincter, ileocecal sphincter, and anal sphincter. Typically, we doctors divide digestive tract into upper and lower part, and the anatomical border is the pyloric sphincter. Everything beyond this border will most probably manifest with diarrhea, everything above as vomiting. To identify the possibly affected organs and localize the pathologic process, we use topographic anatomy, according to which abdominal cavity is divided into 4 quadrants: upper left and right, and lower left and right, and 9 segments: right and left hypochondriac, epigastric, right and left lumbar, umbilical or mesogastric, right and left iliac, and finally hypogastric region. Each region corresponds to an area where a specific organ is located. Thus, it's easier to localize the organ which is affected with pathological process. That's why physical examination, palpation, percussion, and other additional instrumental methods of diagnosis are crucial on your path of diagnosing the patient. As we have already mentioned in our previous episodes, collecting the anamnesis then will narrow down the diseases that the patient might be suffering from. Normally, to narrow down the list of differential diagnosis, we use syndromic approach, and thus we're using Greek names. For example, esophagitis, gastritis, enteritis, and finally colitis. And of course, each of them have quite definite and specific group of symptoms. How about we see each one of them in particular? Esophagitis is the inflammation of esophagus, and the symptoms are difficulty swallowing, dysphagia, painful swallowing, odynophagia, chest pain during eating or heartburn, cardialgia. By the way, this has nothing to do with heart. Food impaction, when swallowed food becomes stuck in the esophagus. Acid regurgitation or reflux. Gastritis is the inflammation of stomach, which is typically manifested with gastralgia, gnawing or burning ache or pain in the upper abdomen that may become either worse or better while eating. Early satiety is the sensation of being full after consumption of even small quantity of food. Nausea, discomfort sensation, and urge to vomit. Emesis, or in other words, vomiting. Anorexia, absence of appetite. Dyspepsia, impaired digestion. Regurgitation, the backflow of food content of stomach into the esophagus. Reflux, the backflow of acid stomach into the esophagus. Prostrate fullness, a feeling of fullness in your upper abdomen after eating. Belching or burping. Enteritis, the inflammation of small intestine, and symptoms may include abdominal pain and cramping, typically in the upper part of the abdomen, watery diarrhea, dehydration and weight loss, sometimes nausea and vomiting. Colitis is the inflammation of large intestine, common symptoms of which include abdominal pain and tenderness, most often in the lower parts of the abdomen, diarrhea containing feces, mucus, pus, and sometimes blood, fecal incontinence or encopresis, involuntary loss of bowel contents, tenesmus, a feeling of constant urge to defecate despite the empty colon, bloating and flatulence, accumulation and release of gas from the intestine, fatigue and weight loss. In infectious diseases of digestive system, we define several prominent syndromes, such as diarrheal syndrome, which is typically present in enteritis and colitis, and intoxication syndrome, unspecific and includes symptoms like fever, nausea, vomiting, and fatigue. Alright, so now let's go to the definitions. Diarrhea, it is a condition of having at least 3 or more of loose or liquid bowel movements per day. World Health Organization defines 3 clinical types of diarrhea. Acute water diarrhea that lasts several hours or days and includes cholera. Acute bloody diarrhea, also called dysentery. And finally, persistent diarrhea lasts more than 14 days or even longer. However, pathophysiological classification of diarrhea includes osmotic. The increased osmotic pressure pulls water and leads to redistribution in the interstitium of fluids and then into the lumen from the mucosa. Exudative, typically due to the inflammation which leads to the mucosal exudation. Secretory, enhanced secretion of enterocytes, or in other words, activation of the chloride channels, and thus leads to outflow of water from the cells. It is usually induced by enterotoxins. Motor, or increased motility, increased peristalsis, which means increased bowel movement, and therefore it causes rapid passage of the bowel content. Knowing these things is very helpful for a physician because it helps us to narrow down the list of species which could have possibly caused the disease. For example, knowing the mechanism of how the particular pathogen behave in our body, we know what type of diarrhea they can cause, and thus we can pick a correct method of diagnosis. Of course, it is very general and definitely requires verification, but roughly we can make such assumption that the small bowel is mainly affected by viruses or enterotoxigenic bacteria, and some parasites like Giardia and Cryptosporidium. Unlike the large bowel, is mainly infected by bacteria and parasites like Entamoeba and Balantidium. Now let's have a look at available methods of diagnosis. Microscopic, such as dark field or fluorescence. Bacteriological, culture and staining. And serological assay, immunosorbent, immunoblotting, immunochromatographic, polymerase chain reaction, etc. And of course, general laboratory workup such as complete blood count, biochemical like liver function test and blood chlorides, and urine analysis. Combination of anamnesis, physical examination, and laboratory findings gives us a clear understanding of the cause of the disease and possible methods of treatment. Later in this course, we will discuss each infectious disease in particular, as well as each individual causative agent. However, before we move towards the specifics, we must discuss one of the most important aspects of infectious diseases, the natural course or the periods of the disease. After the disease transmission, each causative agent goes through the incubation period. During this period, the causative agent reproduces and accumulates in the numbers required to fully manifest as the disease. Prodromal period, it is a period of non-specific symptoms like fever, fatigue, myalgias, etc. Basically, it's a period when the pathogen has increased in numbers, and now due to the immune response, our body is trying to tell us that something is wrong. Period of actual illness, it's the period during which the disease actually shows all its colors, or in other words, all the typical symptoms characteristic for the particular pathogen. Convalescence, or another more common name, recovery. However, some diseases may persist longer and we call it chronization. This was our third episode. If you enjoyed it, give it a thumbs up and don't forget to subscribe to the channel and hit the bell to be updated of the new upcoming episodes.